Hi everyone, welcome back to my channel. So I just finished up my orthopedic sports medicine rotation and I learned so much, and I also got to work a lot along the sides of PAs. So I wanted to share my experience with you guys. And I know a lot of you were considering PA school versus medical school and how it's different and stuff. So I feel like in this video I can give you a better understanding as to the perspective of PAs in the content of orthopedic surgery or PAs that do surgery. So first off, what I learned, I really liked my preceptor for sports medicine. He let me do all the injections, so I got very comfortable with doing shoulder injections, both interarticular and subacromial injections, and I also got to do a lot of knee injections. I've done them outside the clinic before, but only a couple times, so during these past 2 weeks I felt like I did around 50 injections, and so I felt really comfortable doing them now, and I'm confident when I do them by myself in my own clinic. Another thing that I learned to do was bug. Another thing that I learned to do was read x-rays and MRIs and CT scans. So how it works during clinic is he'll have 10-minute templates, which means he'll see patients in 10 minutes. And so before each patient, before we go into each room, I would usually pull up the x-ray or the imaging that he ordered, and he'll ask me, so what do you see on this imaging? And he would ask me what I would recommend for this, or what kind of therapy is ultimately needed. Like, does this person need a total knee, or is it not bad? Does he just need to go to physical therapy? Things like that. So yeah, those are the things that I'm pretty confident in doing now, and I'm very thankful and grateful I had this rotation. I feel like it's super beneficial for my knowledge and my technical skills later on in my career. And then I worked also with PAs a lot, especially during surgery. Not so much in the clinic, but during surgery I was with a PA because they're usually first assists. And what first assist means is, so the physician, the surgeon, is doing the surgery, the first assist would just assist him or her. So like retracting, suturing, suctioning, and stuff like that. And then I would probably be second assist. If not first assist, then I would be second assist. So I worked with PAs in 3 different settings. The first time I was with a PA was at a pediatric clinic, and I felt like the PAs had a lot of autonomy at that time. They saw their own patients, they wrote prescriptions, but most of the time it was pretty routine, the patients that they saw. It was always sick kids with like ear infections or runny noses, or during flu season, you know. So it was nothing that they really needed to ask the doctor about, unless it was something out of the ordinary. Then they'd be like, okay, let's go talk to Dr. So-and-so and see what kind of management we need to do for these patients. They would never really go to the hospital if a kid was admitted. The doctor would do that. The second time I worked with PAs was in the ER, and these guys were phenomenal. They actually had the time to teach me different things, so it was pretty awesome. They had a lot of autonomy as well. They saw their own patients, they wrote all the notes, and the preceptor didn't, or the doctor overlooking them, didn't really see the patient at all. They would just read through the note and basically approve the note. So like in every profession, I feel like there are good PAs and bad PAs. There's good doctors and bad doctors. From my personal experience at that time, I felt like the PAs in the ER were better than the PAs in peds. I felt like they were more knowledgeable, and I don't know, maybe it's just a different setting. This year I worked with PAs who actually do surgery, orthopedic surgery. So they also have clinic days and surgery days, and during the clinic they'll see patients. Usually it's the follow-up patients. There's not much that needs to be done, basically, just to make sure everything's okay. There's a protocol that the doctors write out that the PAs follow. If they do see a patient and they feel like that patient does need surgery, then they have to refer back to the doctor for him to, like, it's like a pre-op visit to prior authorize this patient or to see if this patient actually needs surgery. I guess I would say, like, these, oh my goodness. From my experience, I guess compared to the PAs who are in the ER and the PAs who are in the pediatric clinic, the orthopedic PAs had less autonomy, maybe a little bit less. During surgeries, as I said, they were first assist, so they would suction. Usually at the end, when all the surgery is done, they would be closing. I guess it would also depend on the surgeon that they're with during surgery, which determines how much surgery they'll actually be doing. Some surgeons just want them to retract, which means hold back stuff, and other surgeons actually let them drill and screw in stuff. And so it's very surgeon dependent on how much you as the PA will get to do. Most of the time the surgeon will let you close, so when you open up the skin, at the end the PA will close it. But as for doing the surgery itself, I would say as a resident, as a med student, I felt like I was doing as much surgery as the PA was. They're obviously more knowledgeable than I am, but I felt like surgery-wise I was doing as much. So if you're considering going into PA school, there's lots of perks to that, like schooling is only 2 years and you get to jump around in different specialties such as dermatology, surgery, pediatrics, ER. The options are endless. The only downside to that is your basically scope of practice. Not as much autonomy and shot calling or decision making, and you have to work under a physician. And so sometimes a PA and a physician would disagree, but at the end of the day, it sucks because what if the PA is right and the physician is wrong? Like, as a PA, it's like you're still considered a mid-level, I guess. So this is the first encounter that I actually been with a PA who's in surgery, and it was cool to see all the stuff that they actually did. So, because I always tell people, yeah, the PAs can do surgery, it's just how much surgery you want to do, you know? So yeah, that was my experience. You probably have a lot of other questions, I just can't think of anything to answer right now. But, oh yeah, so I asked the PA if they had to have extra training to become like surgically qualified, I don't know, any special training or specialization or residency or anything like that after their 2 years to do surgery. And then he said, no, you get training on the job, but there's no special residency or anything like that after PA school. And I know a lot of you are gonna ask, do I wish I went to PA school rather than medical school? And my answer is still no. Like, I love the fact that I'm a physician. I love that I am responsible for my own patients. I love the autonomy that I have. And I feel like, me personally, I can't work under someone. Like, I like the decision making, and I like the thought process behind the care of the patients. And so I feel like I get to do that more as a physician as compared to a PA. But that's just my personal experience, and my experiences with PAs are very limited. So maybe there are some PAs out there who have a lot more autonomy, who do a lot of the decision making, but that's just my opinion from personal experience. So yeah, I hope you guys enjoyed this video. There's probably a lot of other questions that you have that I probably didn't answer, so if those come up, leave them in the comment section below. As always, you guys know, if you like this video, please give it a thumbs up. It really helps me out. Subscribe so you don't miss any videos, and I'll see you guys next time.
Bah. Bah. Bah.